Podcast.com.
Hello and welcome to our video. In this video, we will do a presentation of a case study of a patient who had invasive ductal carcinoma, or in other words, breast cancer. Throughout this video, we will start on the biographical data of the patient and the physical assessment, pathophysiology of the disease, the management done for this patient, and last but not least is the prioritized nursing care plan for this patient. A 52-year-old female came from Daro, Sarawak to be admitted in female radiotherapy unit at Sarawak General Hospital. She is an IBAN and she was married with 2 children, each 21 and 14 years old, which currently living with her and the husband. According to patient during interview session, she is a non-smoker and non-alcoholic person. She works at a spa before, she being unemployed due to her cancer since 2015. She claimed that she's having underlying hypertension under medication and still keep following checkup with nearby clinic at her hometown. She also had diabetes mellitus type 2 but only found out about it after her admission to SGH. She also had allergies to dried salted fish. For her past medical or surgical history, she had undergone chemotherapy treatment for her breast cancer at Sibu Hospital. And when she was asked if there is any family member that had the same problem, she claimed that one of her niece also had experienced breast cancer before. For the physical assessment, we followed the Gordon Functional Health Pattern. For her nutritional and metabolic pattern, she had no complaint with her appetite during current admission and usually eats according to the hospital routine. No nausea, vomiting or dysphagia recorded. For her elimination and bowel pattern, she usually empty her bowel daily or once in 2 days and claimed had no problem regarding her urine output. For her sleep and rest pattern, she had complained had disturbance of sleep due to her pain upon admission, but had subsides after undergo pain management and treatment. She usually sleeps 5 to 6 hours at night and also had taken nap during the day sometimes. During interviewing patient was calm but noticeable that patient was worried about her children's condition and their financial problem. Reflashback from what happened in 2015, she experienced mild pain and palpable mass on her left breast. She only consumed paracetamol as pain reliever and only seek medical help 2 years after, due to the worsening pain and presence of discharges from her nipple. She had done chemotherapy treatment at Sibu Hospital and completed it earlier of 2018. Cancer forms when our normal body cells start to divide in altered pattern, or in other words, mutation. It multiplies without control and resulting in tumor which compose of a cluster of abnormal cells together. But how? This happens when first, due to increase of oncogenes which are RAS genes and MYC genes, and second is due to decrease of tumor suppressor which are P53, APC, and BRCA1 and 2. These two causes lead to uncontrolled cell growth, which leads to cancerous cells to form. For example, our cells contain DNA and genes, which one of them is RAS genes. RAS genes function to produce RAS proteins, which basically it is placed in the intracellular plasma membrane together with the presence of growth factor receptor. When there is growth factor that binds to the receptor, it stimulates the RAS protein to undergo a cascade of intracellular phosphorylation, which results in activation of transcription factor. When this happens, the genes will transcript and produce protein for cell growth, and specifically from G1 to S phase transition of cell cycle. These proteins are CDK and cyclin, which are known to be the drivers for cell growth. To summarize, when there is an increase of oncogenes, it increases the cell drivers production and induces uncontrolled cell growth. The tumor suppressor works to cancel any abnormal cells with damaged DNA to proceed to the next cell cycle steps. Focus on P53, the tumor suppressor. It produces protein for DNA repair and also the protein for apoptosis. This means if the DNA could not repair, the cell has to die. So if there is no activation of the tumor suppressor, there is no protein for DNA repair or apoptosis is produced. Hence, nothing will stop the abnormal cells to die and it will replicate. Cancer did not stop there. It can grow and spread to other organs or beyond the affected part itself, hence affecting other parts of body organ or tissues. This process is called metastasis. In this case, patient was diagnosed with invasive ductal carcinoma, which is the common type of breast cancer. Invasive gives the meaning of the cancer cells has invaded to other breast tissues, which also means it has metastasized, while ductal means the cancer starts at the milk duct that carry milk to the nipple, and carcinoma means the cancer that starts off at the layer of skin or tissue that is on top of internal organ. This patient had experienced several common signs and symptoms of breast cancer, which are pain, palpable mass presence, and discharge from the nipple. Other signs or symptoms that may indicate breast cancer are swollen breast, thickened skin or breast tissues, size of the breast increases, itching or burning feeling, or presence of lump at the armpit. There are certain population or group of people that is at high risk of developing breast cancer. Women is the most affected group of developing breast cancer. Not just that, older women aged 50 and above are likely at higher risk. Having the family history of having breast cancer also could affect this kind of people, especially those first degree relatives, for example, sister, mother, and daughter. Weight also can be one of the risk factors because the excess fat tissue, which will be the main source of estrogen after menopause, can increase breast cancer risk as high estrogen level. Alcohol consumption can limit the liver to control estrogen in blood. In this patient case, she probably affected by the family history of having cancer and due to her age and gender.
Now, let's move on to the management or care provided to the patient. The first one is chemotherapy. As what we can see in the table, the patient undergo chemotherapy since April 2017 until July 2018 with few different regimes to manage the cancer cells. The cytotoxic drugs used are docetaxel, doxorubicin, cyclophosphamide, gemcitabine, and carboplatin. These drugs will interfere with the growth and spread of the cancer cells in the body. In the column before the cytotoxic drugs, we can also see the list of pre-medication drugs which will be administered before the cytotoxic drugs administration. This is to manage the side effects of chemotherapy, commonly nausea and vomiting. After patient completed chemotherapy, the patient then was planned for radiotherapy. Radiotherapy or radiation therapy is the use of concentrated radiation beams to kill cancer cells in the management of cancer. The patient is receiving external beam radiation with 40 gray in total, divided into 15 fractions, with each fraction contain 267 centigrade. Apart from chemotherapy and radiotherapy, wound dressing was also done to manage the wound on the left breast. It was done once every 2 days under septic technique. Paraffin gauze and calcium alginate were used as wound dressing products. However, the outer layer of the dressing will be changed daily. As what you can see in the table, it is a list of medication. This is the medications prescribed to the patient throughout hospitalizations to manage few conditions. The drugs are lactulose, paracetamol, tramadol, cefuroxime, chlorpheniramine, atenolol, gliclazide, amoxicillin, potassium chloride, metformin, and hydrocortisone. Now, let's move on to the management or care provided to the patient. The first one is chemotherapy. As what we can see in the table, the patient undergo chemotherapy since April 2017 until July 2018 with few different regimes to manage the cancer cells. The cytotoxic drugs used are docetaxel, doxorubicin, cyclophosphamide, gemcitabine, and carboplatin. These drugs will interfere with the growth and spread of the cancer cells in the body. In the column before the cytotoxic drugs, we can also see the list of pre-medication drugs which will be administered before the cytotoxic drugs administration. This is to manage the side effects of chemotherapy, commonly nausea and vomiting. After patient completed chemotherapy, the patient then was planned for radiotherapy. Radiotherapy or radiation therapy is the use of concentrated radiation beams to kill cancer cells in the management of cancer. The patient is receiving external beam radiation with 40 gray in total, divided into 15 fractions, with each fraction contain 267 centigrade. Apart from chemotherapy and radiotherapy, wound dressing was also done to manage the wound on the left breast. It was done once every 2 days under septic technique. Paraffin gauze and calcium alginate were used as wound dressing products. However, the outer layer of the dressing will be changed daily. As what you can see in the table, it is a list of medication. This is the medications prescribed to the patient throughout hospitalizations to manage few conditions. The drugs are lactulose, paracetamol, tramadol, cefuroxime, chlorpheniramine, atenolol, gliclazide, amoxicillin, potassium chloride, metformin, and hydrocortisone.
Hi, I'm Nicholson. I'm gonna explain about patient progression based on time frame and the prescribed medication. So let's go. The progression start on this date before patient admitted to female radiotherapy unit. The blood test of the patient shows hyponatremia. Then this prescription was given to the patient and the sodium level managed to increase to 1 to 6 milliequivalents per liter. After that, patient admitted to female radiotherapy unit. On this date, there are two abnormal electrolyte levels shown on the patient: hypokalemia and hypomagnesemia. For the hypokalemia, there were two prescriptions that was given to the patient to increase the patient's body potassium level. It was resolved on the next day. For the hypomagnesemia, after this prescription was given, the patient's body magnesium level increased to 0.57 millimole per liter. After that, the prescription was reduced to prevent too much increase in the magnesium level, and it was resolved on this date. On this date, there are two patients' problem: itchiness and hypotension. The patient showed symptoms of itchiness over facial and both hands. This may due to the allergic reaction to some medication. Then this prescription was given to the patient to treat the allergic reaction. The patient having less itchy after the prescription, but rashes are developed over facial and both hands. So this medication was prescribed immediately. And after the prescription, patient having mild itchy but still having redness over face. Later, the medication was downgraded and the condition was improved. For the hypertension, it may due to the adaptation of blood pressure because of the prescribed antihypertensive drug. So this medication was off already and 1 pint of normal saline bolus was prescribed. However, the blood pressure still low after the bolus. So the prescription was changed and the blood pressure was in normal range and maintained. On this date, patient in febrile state. It may due to the bacterial infection, so this medication was given immediately with the aid of the tepid sponging. After the next day, patient temperature returned to normal and the swab's culture and sensitivity shows that there was no bacterial infection. On this date, the serum blood glucose level was high. When being asked, the patient took teh bunga and ate some meal in the morning. So this prescription was given to the patient and serum hemoglobin A1C test was taken. However, the glucose level is still high. So another prescription was added. On this date, patient diagnosed with diabetes mellitus because serum hemoglobin A1C is high. Another prescription was added. At the next day, the patient showed an increased osmotic symptoms. The patient was referred to optical clinic to screen for diabetic retinopathy.
Physical examination done. Madam X nails show a good nail growth, generally intact skin condition, normal color and temperature of skin and minimal hair loss. She has a normal body posture and gait. Face examination. The eye are pearly and clear, no ear infection, while mouth are normal gum and teeth, no denture and slightly moist and pink tongue. Her neck and chest examined, noted 4x4 lump at the right side of the neck, wound 16x15 at the tail of Spencer, and wound at the areola 13x13 cm at the left breast. Both lungs are heard clear when ausculted. Normal abdominal assessment notice she has striae, slightly concave of abdominal, but symmetric and tympani sound and soft abdominal. Upper and lower extremities has normal reflex. CRT less than 2 seconds. Normal skin temperature and no edema. Madam X alert, able to walk around the ward without assistance and no sign of SOB.
Our first nursing diagnosis is acute pain related to disease process, inflammation and destruction of nerve tissue at the left breast, as evidenced by verbal report of pain score of 2/10 at the left breast. Our goal is patient will verbalize pain score of 0/10 within 3 hours. Our nursing interventions are: first, assess location, characteristic, onset, duration, frequency, and severity of the pain to ensure patient receive effective pain relief. Second, advise patient not to sleep in left lateral position to avoid compression of the mass at her left breast. Third, advise patient not to lift heavy object with the left hand to avoid putting extra pressure to the left hand. Fourth, advise patient to rest in bed to help patient to relax. Fifth, provide patient quiet environment to reduce additional stressor to the patient. 6. Administer analgesics such as tablet paracetamol 1 gram, capsule tramadol 50 mg as prescribed to reduce pain. Our evaluation is patient mobilized pain score of 0/10 after 3 hours. Our second nursing diagnosis is deficit knowledge regarding disease process, treatment, and individual care needs related to unfamiliarity with information and newly diagnosed diabetes mellitus, as evidenced by verbal report of statement of concern about the disease. Our goal is patient will be able to explain about the disease state, recognize need for medication, and understand treatment within hospitalization. Our interventions are: first, assess client readiness as well as her barrier to learning to ensure that she are physically, emotionally, or mentally capable of the information. Second, provide information relevant only to the situation to prevent information overload. Third, explain with short and simple concepts to facilitate better information retention. Fourth, discuss one topic at a time and avoid jumping into different topics to avoid patient confusion regarding the information. Fifth, provide written information or guideline and self-learning modules, especially about the proper diet essential for diabetic patient to guide patient if she needs clarification or relearning in future. 6. Provide feedback and positive reinforcement and evaluate learning of skill to encourage continuation of patient effort to learn. 7. Educate about the additional learning resources like diabetes care video and brochure to assist with further learning and promote client learning at own pace. Our evaluation is patient will be able to explain about the disease state, recognize need for medication, and understand the treatment within hospitalization.
Nursing diagnosis with intervention. Imbalanced nutrition less than body requirement related to side effect of cancer treatment, as evidenced by weight loss about 0.5 kg in 5 days. Goal: patient will have adequate nutritional status evidenced by increased dietary intake. Number 1. Assess current eating pattern including usual likes and dislikes and identify factors that impair food intake to allow more individualized plan based on needs and preference. Encourage eating whenever is appealing and consider adding nutritional supplements such as ensure to diet. Number 3. Eat small, frequent meals. Those are more easily digested and absorbed and usually better tolerated by patients. 4. Teach to keep a food diary to document daily intake. Documentation helps to see how many patient able to tolerate and patient can consume more if tolerated. 5. Encourage patient to eat small, frequent, low-fat meals such as cracker and toast. Dry, low-food diet are more readily tolerated when nausea. Number 6. Weight patient twice a week to monitor weight and nutritional status.